The following is the recording for the occupational English test, and the test is held at Medcity International Academy, Kannur on the 17th of January 2024. The candidate is Stuti Chopde and the candidate number is 2843. The interlocutor is Shyam and the interlocutor number is 9263. This will be roleplay number 1 for the profession of nursing. Good evening, Stuti.
Good evening, sir.
May I please see your identification?
Here it is.
Thank you. Here you go.
Thank you.
Okay. Stuti, please note that this is a test of your English language and not in any way an assessment of your professional knowledge. Bear that in mind and speak as you would in any situation as naturally as possible. We will move on to a warm-up session where I'll be asking you a series of questions. This is not in any way assessed. These questions are asked so that you get familiar with this new environment that we have created here. So my first question is, what do you think is the best thing about your job?
Yes, sir. According to me, I think the best thing about my job is nurses care for the human beings, not the machines. And second thing I think is that all the other professions are only evaluated by their theoretical knowledge, but we are also evaluated by our patient knowledge. We can learn from the patient. So I think that's the most important thing in our profession.
All right, wonderful. What advice would you give someone who is deciding to become a nurse just like you?
Yes, so there are a lot of advices, but I would like to make in point is that try to be a good communicator, try to understand your patient, try to be punctual so that there is no any delay in patient's care. So yeah, that's the point I want to tell upcoming nurses.
Great, great. I'll ask you one last question before we move on to the actual role play. Do you think there is a major difference how nursing is practiced everywhere else in the world when you look at India particularly?
Yes, definitely I think that because the working hours in India differs from the foreign working hours, because the working hours over here are weekly, we have to work, more than that also we do work, but in foreign hour there are limited hours and we are paid, if we are doing extra we are paid for that also.
Right.
So yeah, that's the main thing.
Okay, now we can conclude the warm-up session. I hope you're ready for the role play.
Yes.
Okay. We'll move on to the role play now. I'll be taking the part of the patient, bystander, or any similar role. You'll be taking the role of the professional, which here is the nurse. The role play will last a total of 5 minutes, and to prepare for it, you'll be given 3 minutes. The role play intends to get evidence of your ability to perform effective communication with patients. Do you have any questions?
No, sir.
All right. So here is your card, and here is a pencil. If you would like to make notes on the card, you may do so, but at the end of the test, you must return it to me.
Okay, sir.
All right. So your time for preparation begins now. Okay, so that is the end of your preparation time. We
Okay,
will
sir.
now move on to the actual role play. Is that all right?
Sir, how may I address you during the skit?
During this role play, you may address me as Rufus.
Okay, sir, thank you.
You are welcome. So we will start the role play now.
Good morning, Rufus.
Good morning.
I'm really glad to meet you again, Rufus. So today you're here for your pre-operative assessment regarding your hip replacement next month. Is that right?
That is correct.
Yes, Rufus. So before I start with the assessment, do you have any questions?
Yes, I do. The consultant, my doctor, explained to me that I'll be needing a pre-operative assessment before the actual operation when I last saw him. But I don't know exactly what that means. Could you explain it to me?
All right, Rufus, I'll explain it to you. So firstly, we'll be collecting all your complete health histories. That means your background, your current histories.
Right.
Then followed by a record of your weight and height, your blood routines, and your MRSA swabs regarding to know the infections. And lastly, I will provide you with advice regarding how you have to be prepared before your surgery. Okay, Rufus?
Okay.
So do you have any questions?
Well, I understand the medical side of things, but I don't see how I can prepare for the operation.
Yes, Rufus, that's really a good question from your side. I'll explain it to you.
Please do.
So, firstly, I'll be advising you regarding the pre-operative exercises.
Right.
Okay, so that will really help you to maintain your mobility around the hip, strengthen your muscles, and also followed by improvement in your posture, your walking pattern, and also support your new joint.
Right.
Okay, Rufus, are we on the same page so far?
Yes, we are.
Yeah. And lastly, I will also explain you regarding the discharge planning. Okay, so that will include a lifestyle modifications and possible assistance, what will be your need after the surgery, and preparing of your house for more easier and safer movements. And please don't worry regarding the transportation,
Right.
because we'll be providing you to and fro from the hospital. Okay, Rufus?
Okay.
So I'll also provide you a information booklet,
Right.
which has all the detailed information regarding this, and you can read that.
Okay, I will.
Well, do you have any other concerns?
Well, I do have a major concern. I've read negative reports about the operation not giving the right kind of results, and when the new hip is placed, it doesn't fit, and people had infections and DVT, whatever that is. Could you tell me, is there such a risk?
Yes, Rufus, I'm really glad that you point out this point in front of us. So, as this is a procedure,
Right.
every procedure has a minimal risk. Okay, Rufus? So, in this procedure, you are been assisted by a well-equipped hospital, a well-experienced doctors who have already handled this kind of cases.
Right.
Okay, so it is a common operation which will be performed by a skilled surgical team, and a minimal risk are been there in this
Okay.
procedure.
Okay.
And the point you mentioned me regarding the artificial joint, is that true?
Yes, exactly.
Yeah. So regarding that, it will be pre-measured and adjusted,
Right.
and will also make sure that it exactly fits your hip. Okay, Rufus?
Good. Okay.
Yeah. And regarding the possible risk, if you're asking me regarding that, the doctor will inform you in detail on the operation day, followed by a form he'll be providing you that is called a consent form.
Right.
After he provides all the possible risk information, you have to sign on that, Rufus.
Right. Okay.
Okay.
All right.
So does that sound good?
That does sound good, but another concern that I have is about staying in the hospital. Some say 3 to 5 days, others say much longer. I want to be able to move on back home as soon as possible.
Yes, Rufus, I can understand your condition that you might be not feeling willing to feel to stay in the hospital for a longer time. But I want to make this point in your note. That is, the recovery time differs. The recovery period differs from person to person.
Right.
So we have to make sure you're out from your anesthesia effect. You're walking properly. Your
Right.
pain is reduced. Okay, so after that we'll provide you with the discharge planning,
Right.
and also we'll provide a consultant or a physiotherapist advised
Okay.
for your hip care to return back to your normal activities, followed
Right.
by a follow-up appointment. Okay.
Okay.
Yeah, do you have any questions?
Well, another question that I have is, how will I know if the operation is a success?
Yes, Rufus. So this will be confirmed by the doctor. Okay, so
Right.
he is an authorized person to confirm that. Okay, Rufus?
Right.
Do you have any another question, or should we move forward with the assessment?
Oh, well, we can move on with the pre-operative assessment. I think you cleared all my, you alleviated all my concerns and cleared all the questions that I've asked you. I am really thankful. And that will be the end of your speaking test today. You can return the card to me now.
Yes.
Thank you.
Thank you, sir.
Medcity International Academy. Trusted hands forever.